Did you know that it's possible to have wisdom teeth extractions without any swelling? That's right, skipping the chipmunk look altogether. In this episode of Hints and Tips in Dentistry, I'm going to describe the advances in third molar surgery using minimally invasive techniques that helps to prevent swelling and minimize risk of infection and dry sockets, as well as promote quicker healing and recovery for patients. I'm Dr. Ryan Kazemi, and welcome to Hints and Tips in Dentistry. Minimally invasive techniques have become increasingly popular across different specialties in both medicine and dentistry. Using smaller incisions, less openings, and working through pinholes using scopes are some of the techniques that are used for less invasive surgeries and hence less complications and a more rapid patient recoveries. Many of the procedures which used to require hospitalization and long recoveries can now be done as outpatients thanks to such techniques. Extraction of impacted wisdom teeth is certainly no exception. The traditional techniques involve large incisions, extensive gum tissue flaps, and very aggressive bone removal, all of which can contribute to postoperative edema or swelling, pain, as well as complications such as infection or dry sockets. Such traditional techniques are still quite common and are used by many clinicians. And that's because it provides a wide and a full access with visualization of the wisdom tooth during the procedure, and hence much easier to perform. In pursuit of better patient experience and less complications, we began to implement several modifications in the surgical techniques that have gradually evolved over the last 2 decades. These modifications include using micro-incisions, minimal gum tissue flaps, and a tunneling technique in order to keep the procedure very conservative and less intrusive. While it's technically more difficult to perform, the outcome for the patients are unparalleled. No or minimal swelling, significantly less discomfort, no muscle tightness or difficulty in opening after the procedure, and minimal risk of infection and practically elimination of the risk for dry sockets. Patients recover much faster and quicker and are ready to return to work or school and normal function within a day or two. Our minimally invasive technique, as used in this patient with a full bony impacted wisdom tooth, includes a micro-incision, a very small gum tissue flap for access, a gentle tunneling technique to slightly mobilize the soft tissue, a very conservative and minimal removal of bone for access, and precise sectioning of the teeth to smaller fragments, which when done properly, allow the teeth to be removed with minimal trauma and in fact quite gently. We then clean and wash the area and place a single resorbable suture to close the micro-incision. The entire procedure takes no more than 5 to 10 minutes for each tooth. More importantly, this patient will have absolutely no swelling and minimal discomfort after surgery, and will take only a day or two before returning to work or school and normal activities. Remember that excessive swelling, pain, and long recoveries after wisdom teeth extractions are due to conventional surgical techniques that are still widely used, mainly because they're easier to perform. On the other hand, minimally invasive techniques with micro-incision and flaps can potentially eliminate all the swelling and significantly diminish postoperative pain and risks of infection, as well as dry sockets. They also help patients recover faster and get back to their lives much quicker. For more information on wisdom teeth extraction, download my free ebook, The Wise Guide to Wisdom Teeth Extraction. And if you need help with your wisdom teeth and want all the benefits of minimally invasive techniques that I described in this video, give us a call. I'm Dr. Ryan Kazemi, and I look forward to seeing you again soon on our next Hints and Tips in Dentistry.